Hey, it's Dr. Molski with Freedom Health Centers, and today I want to talk about an interesting topic, and that is going to the chiropractor versus the real doctor. So that is an interesting topic. You know, if you look at the whole system and background of, our education in terms of chiropractic versus medical, you can look all that up and see that for yourself as that both those educations are equal. There is no difference in that. That is well known. In terms of it just being called a real doctor is always an interesting subject because, PhDs are called doctors, naturopaths are called doctors. It all comes down to somebody trying to monopolize that term and those kind of things. So it's just an interesting thing. Doctor means teacher, okay? And so what we do in terms of teaching is really trying to work towards improving your health, okay? In the medical world, look at it this way. This is my analogy, and that is that if you're going to try and build your house and all you have is a hammer, you can build that house. It ain't gonna look too good. If you have a bunch of tools in your tool belt, it's gonna come out a lot better. And so what's the medical professional's tools? Drugs and surgery. What we have here in terms of our office is we have an integrated office, yes, but if it's just chiropractic, the chiropractor, what's their tool? It's called the chiropractic adjustment. Now they may know a little bit about nutrition and a little bit about exercise and those kind of things too, and that's good. But here at our office is the integrated setting is you have chiropractors, you have medical professionals, you have physical therapists, you have massage therapists, and you have nutritionist people. So we're able to look at all those different aspects and have many different tools in that tool belt, which is huge. One of the things that we've seen in the past, and I actually had a person the other week, is wanting to come in and they get the information from us, and then they're going to go to the orthopedist to get a second opinion. So an orthopedist is really, their real term is called an orthopedic surgeon. So what do you think their tool is? Surgery. So what do they want to do to you? Yes, surgery. So you're comparing their apples to oranges. It's totally different. And to get a second opinion from somebody who's totally different doesn't make any sense. It's like, I'm gonna go to my general practitioner to get a second opinion as to these things. Well, again, it's not right. It's not comparing the right things. So, with our ability to do all the different things that we do here is such an important thing. And if we need to step you to an orthopedist, that's what we're gonna do. That's our morals, our ethics are there. That's what we have to do for you. Because we don't want to waste your time, we don't want to waste your money, we don't want to waste any of that stuff with what we do here. In terms of stepping back to a general practitioner is, unless you need some sort of medication or we find something on your lab work or something like that that needs that specific care, we can always do that. But in terms of your physical health and the physical medicine things that we can do here, it's so important. So, when you look at the chiropractor versus the real doctor, just start getting educated on that a little bit, and that'll help us out.